Hello and welcome to SCAI-TV from sunny San Diego. Have the pleasure of being here today with Rolf Graning from William Beaumont Hospital, a rising star in SCAI and the recipient of the Braden Memorial Fellow of the Year. Greg, thanks for being here.
Thank you, sir. I'm truly honored and humbled to be here.
Well, we're glad you're here and you're the future of SCAI. So this award is actually given to what we think is really one of the best fellows in SCAI based on your research and clinical abilities. What kind of research have you been interested in?
So I think one of the current protocols that I'm working on now is in terms of IVUS guided PCI and contrast minimization in patients that are high risk for contrast nephropathy. That's one area that we currently have a protocol that we're working on and getting ready to start enrolling a prospective trial on. And then also, I think my true passion, one of the things that I enjoy the most is CTO procedures. And seeing patients pre and post CTO, just the amount of clinical improvement that they have, led us to look at VO2 improvements, both before and after on these patients, just to see if we have any improvement on cardiopulmonary exercise testing.
Yeah, this idea about residual ischemia and its impact on not just patients' quality of life, but longevity is important. That's interesting that VO2 max. Can you just tell us in a couple of words what you're seeing with people that get revascularized from CTOs? What are you seeing?
Well, so clinically, I think that many of us that do CTO procedures, we see this immediate benefit in patients that just come in with these symptoms of shortness of breath and pressure on their chest. And as soon as you have a successful procedure and you see them even in the recovery room, they immediately tell you how much better that they feel. And this has been something that, again, we see time and again. And so wanting to look at this from an exercise standpoint, we know that people's 6-minute walk tests get better, their exercise endurance gets better, but really breaking it down to a VO2 standpoint, we don't know anything about. And I'm hopeful that we're going to see a lot of clinical improvement in patients.
That's great. That's great. So is this your first SCAI meeting?
Yes, sir, this is.
That's great. It's great to be here as a young investigator, as a new, hopefully, SCAI fellow in the future. What are your plans in the future?
So I've finished up, this is my second year. I did a 2-year interventional fellowship at William Beaumont. First year all in coronary. The second year has been dedicated to complex coronary interventions, so CTOs primarily, as well as all peripheral procedures. And so I've done a lot of peripheral. And so I'm active duty military. I'm with the United States Navy, and so I'm going back to the Naval Medical Center in Portsmouth, Virginia, where I will continue my career there.
Well, that's awesome. Thanks for your service. It's important that the men and women serving in our armed forces actually have excellent care, and I'm sure they're going to get it from you.
It's my privilege.
Well, this is SCAI-TV in San Diego. I would like to say that Greg Braden was a great teacher, an incredible interventionalist, and Rolf, I think you're going to continue in his footsteps, and I can tell you that the Braden family is very proud to have given you this award. So thanks for being with us on SCAI-TV.
Thank you, sir. My privilege.